So in this study, we evaluated our long-term outcomes with healing complex diabetic foot wounds. We have a multidisciplinary team that addresses diabetic foot wounds in patients that come through both the emergency room and through the clinical setting. In patients with very extensive or severe wounds, the likelihood of achieving wound healing is very low, especially when patients have large tissue deficits or infection of the bone, including osteomyelitis. In this study, we used a complex dermal regeneration matrix that's been described in the literature for other applications in order to achieve wound healing in patients with complex diabetic foot wounds. This has been described in the literature before for healing burn wounds and other smaller wounds, but it's usually contraindicated in diabetic patients because they have poor wound healing potential at baseline due to hyperglycemia. And it's also contraindicated in very large wounds because the likelihood of achieving healing is low. Ultimately, we achieved 67% wound healing potential at 1 year with the dermal regeneration matrix applied once, and 90% wound healing potential if it was applied twice. Ultimately, our wound salvage outcomes were better than 90% at a year, which is significantly better than the 50 to 60% described in the literature. This has not been previously described in the literature for this application, but it's very exciting because it suggests that existing technologies and wound healing matrices that we have in the clinical setting for other reasons can be applied uniquely with good outcomes. And while our study is somewhat limited in the fact that we have a unique setup with a multidisciplinary team taking care of these patients, we think that this can be applied more broadly if people follow a regionalized paradigm and ultimately achieve good limb salvage outcomes for their patients.